morning, everyone. Good morning. Good morning. Good morning. Welcome. You're welcome, Dr. Godwin. You're welcome, Ms. Lois. Welcome to another live session with us. We'll be talking about a very exciting topic that concerns us, which is natural fertility. We'll be waiting for we are waiting for our doctor. That's Dr. Kekere to join us. Dr. Kekere, welcome. I can see Dr. Kekere now. So,
an invite to you.
Hello. Good morning.
Okay. Hello, can you hear me, doctor?
Yeah, I can hear you very well. Good morning.
Hello, doctor. Please, can you hear me?
Yeah, I can hear you now.
Hello.
Good morning.
Hello.
Yeah, hello, good morning. Can
Hello,
you hear me
doctor.
now? Yeah, hello, can you hear me?
Better now. It's clear now. Thank you. Thank you, sir. Good morning, sir.
Yeah,
Good morning,
yeah,
doctor.
good morning.
Uh,
Thanks for having me.
Thank you so much, sir. Please, can we see your face, or in a place where we can see your face?
I thought I'm not visible.
Yes, you're not visible, sir. Your camera is not visible.
Just a minute.
All right, sir. While we are waiting for Dr. Kekere, so welcome once again to our live session, where we will share, talk about health and talk about things that concerns us about our health and how to better our health. Dr. Kekere, I can see you now, sir. I can see
Yeah,
you now,
thank
sir.
you. Yeah,
You're welcome, sir. Thank you so much, sir.
yeah, you're welcome.
So, okay, sir. So, this is Delidoc, and before I continue this live session, let me first of all start by introducing myself. I am Oluwatiyeni Farino, and uh, today we'll be talking about natural fertility, and that's what we'll be discussing with our guest, Dr. Kekere. So, let me just give you an overview of also what we do in Delidoc. So, this connect doctor. We are not an hospital, but we have doctors on our platform. We have general practitioner, we have fertility specialist, we have physiotherapist. Name it. We have optician on our platform, whereby their patient can book them for virtual consultation. So that's what we do in Teledoc. And here we have one of our doctors on the platform. That is Dr. Kekere, and he's here right now to talk to us about natural fertility. So let me start by asking our doctor to please introduce himself, what he does, and try to walk us through his journey in natural fertility? Please, over to you, sir.
Good morning, and thank you very much for having me this morning. I am
All right, sir.
Dr. Fuad Deen Kekere ekun. I am a general medical practitioner, a general physician of about 2 decades clinical experience, and I have interest in natural fertility. And I've been in the practice, in the medical practice, both in the public and private sectors. So, and in the general practice generally, and in the primary healthcare and public health. So, by God's grace, I will be talking about some misconceptions on infertility and why we go for natural fertility, to make people to understand more of their body system, how their body system works, and what to expect while they are trying to conceive. Thank you.
All right, sir. So, without much further ado, let's just go straight into the interview, asking you about what do you mean by natural fertility? Because there's a lot of things going on. So, can you please make us understand, you know, what natural fertility is? Everything that concerns natural fertility, please, sir.
Yeah, when we say natural fertility, what we usually talk about is infertility, which is inability to conceive. So by natural fertility, we mean trying to or learning how to conceive by going natural, trying all the natural means of conceiving. Firstly, we need to understand our body systems, how it works, so that when we notice some changes during our attempts at conception, we understand what is happening to our body. Because most times the patients are misdiagnosed as infertility cases when actually they are naturally fertile and they don't have infertility issues, but what we call subfertility. There are cases that people are fertile but are not able to carry the conception to term, maybe by having early miscarriages and some other problems on the way. But if they are not able to establish the state of their fertility, they easily misconstrue their situation for infertility and they start getting investigated for infertility and treated for infertility, whereas they don't have the problem of infertility. So most people that are faced with these problems actually just need to understand their natural fertility, how their body works, so that they can get help when necessary and proceed naturally. And whenever there is a problem, they seek natural solutions without having to worry about infertility. Since in most cases, there is actually fertility, there are conceptions, but due to one problem or the other along the line, things don't go right and they wrongly misconstrue the situation as cases of infertility.
Oh, thank you, sir, for that answer, sir, for explaining what natural fertility is to us. So I want to go bring it a step further by asking another thing that we've known something about natural fertility now. So there's some factor that can cause a human being, both male and female, to be fertile. So I want to ask, what does age uh, or lifestyle changes, how does it affect fertility?
Yeah, thank you very much. Before talking about the way age affects fertility. I would like to first go into more details about natural fertility. Firstly, we need to clarify what do we mean when we talk of infertility. Because naturally most people are fertile. Then what brings about infertility? We think people have infertility when, after a whole year of regular intercourse of like at least 3 to 4 times in a week, and both partners live together, and none of the partners travel away from the other, especially during ovulation period when most conceptions occur. And despite this regular intercourse for a whole year period, there is no conception. Then we start to think seriously of infertility. And then we start to investigate for infertility, and whatever condition we discover, we try to treat accordingly. But in a lot of cases, actually, there have been conceptions, but people are not aware of it, and they are wrongly presumed to be cases of infertility. Why? Because a lot of cases, the pregnancies are terminated within the first week or first 2 weeks of pregnancy, when most of them don't even know that they are pregnant at all. So this is because most times women believe that they are pregnant when they start to have the feeling of nausea and they start to vomit, nausea and vomiting. But in this first week, there's no nausea and vomiting yet most times. Nausea and vomiting usually starts around the 3rd week of pregnancy in most cases. So when they lose the pregnancy and they see some miscarriage bleeding, they wrongly assume again that their menses has come, and they are thinking, well, since it didn't come on the date that they're expecting the menses, it's either it came early or it came late, not knowing that actually what they are seeing is miscarriage bleeding. Another reason why they miss that there is a pregnancy is when they start to feel some early symptoms of pregnancy, they quickly run a urine pregnancy test at home, which comes out negative most of the time in the first week. Then they go ahead to run a blood pregnancy test in the lab. This also comes out negative in the first week. Why? Because these pregnancy tests are trying to show the level to detect the presence of the pregnancy hormone in the urine or in the blood. And because the pregnancy just started, the level of the pregnancy hormone is still very low. It's just like a trace, and it is not reflecting in the test results. So it gives a false negative result, and they think they are not pregnant while they are pregnant. In a few days' time, when the pregnancy is lost, they think they have seen their menses, which means, yeah, the test says they are negative. That's why they are seeing their menses, not knowing that the test was actually wrong. Most times the test comes out positive by the 3rd week. But if most of those early pregnancies are lost in the first week, they wouldn't know that, there's pregnancy yet, because the test said negative before it is lost. So they miss this knowledge of miscarriage because they are not aware that they are pregnant. The test result is saying negative. But there are actually some natural early symptoms. Those are the natural signs, symptoms that shows that they are pregnant in the very early stage, in the first few days of pregnancy. That's why we refer to this as natural fertility. We need to know what is happening to our body naturally.
Yes, yes.
Number one, most women, they feel these early symptoms, but they are not aware that they are symptoms of pregnancy, so they miss them. Number one, they will miss their period. If a woman is used to having her menstrual cycle every 27 days, When the 27th day arrives, she will miss the period. There will be no menses. This is because she got pregnant some days before that. If she now sees bleeding some days after that, like on the 35th day of the cycle, this is not her menses coming late or delayed. This is an early miscarriage because she's already pregnant. Any bleeding that she sees after getting pregnant is likely a miscarriage bleeding. But since she wasn't aware that she's pregnant, she wrongly assumes that it is a menses that was delayed. And in some cases, she gets pregnant before the date of the expected menses, and she also loses the pregnancy also before the date of the expected menses. In that case, she would think that she got her menses early, which is wrong. So the first of those very early natural signs of pregnancy is that she will miss her period. The date that she's used to seeing it every month for months and years before getting married, she will not see the bleeding of menses. That's because she's already pregnant. So that's one very important sign. The number two, she will start to feel undue weakness and tiredness, especially when she wakes up in the morning. She will wrongly assume that it's just due to, fatigue. We call it easy fatigability. So this undue weakness and tiredness, especially when she just wakes up and she will feel sleepy and drowsy, she feels she needs more sleep. If she tries to sleep some 2 or 3 more hours, when she wakes up again, right on the bed there, she's still feeling weak and tired. This is due to pregnancy. But most women don't know that this is a pregnancy, a natural early pregnancy symptom. Most times, when they force themselves to get up, they may develop headache or dizziness or body aches or feverish feeling. So these are the things that happen to them when they just get pregnant. Number 3, they will feel what we call hot flushes. They'll be feeling internal heat. To be as if all their body is hot from inside. A lot of women feel this, but they don't know that it's due to pregnancy. So when they are feeling this internal heat, it's due to pregnancy. And about the same time, they are feeling some external increase in temperature. All their body from head to toe is equally warm. And the partner is asking, why is your body warm like this? This is due to pregnancy. Most married women who have been trying to conceive or who have conceived before that are listening to me will understand very well what I'm saying, because it's what they go through. So when they start to feel this external temperature or internal heat, it's due to pregnancy, or they sweat more than usual, it's due to pregnancy. Number 4, they will start to urinate more frequently than they are normal. And when they have the urge, they are so pressed, they have to rush down. And after a few minutes, a very short while, the urge will come back again. So they have that urge to urinate more frequently than they are normal. And there is urgency because they can't wait, they have to rush down. So when this is happening, frequency and urgency of urination, it is due to pregnancy in that early stage. Number 5, all of a sudden, they start to notice rashes on their face or pimples break out on their face. So when they notice rashes or pimples on the face, or sometimes small boils on the face, armpit, different parts of the body, when they notice these small boils or rashes or pimples, this is due to pregnancy. They've gotten pregnant. So these natural signs are very important for us to sensitize the people, to increase their awareness of what is happening to their body, so that they don't rush to conclude, that they have infertility problem. So these rashes and pimples is a sign that they are pregnant. Then number 6, they will notice some breast symptoms. The breasts will increase in size. There will be engorgement of the breasts. It will become sensitive to touch. Any slight touch will give pain. It will feel full and heavy, fullness, firmness, heaviness, and tenderness of the breasts. Any slight touch will give pain. Even if the dress touches the nipple, there'll be nipple pain. So when we have this breast increase in size and breast sensitivity, it is due to pregnancy. A lot of women misconstrue that this means that they are about to have their menses, because most times these pregnancies are lost within about a short period of time, like a week or less than 2 weeks. So they wrongly assume that it is a sign that their menses is approaching, whereas most of them know they never used to feel this when the menses is approaching before they got married. So this is an early sign of pregnancy. It is true that in some women they do have this kind of symptom when the menses are approaching, but in most of them who never had it before, this is due to pregnancy. Then the last one, all of a sudden they start to notice whitish or creamy discharge. This is something that is, usually noticed when there is infection. But they have it because the pregnancy brings about low immunity. And whenever the immunity is low, they are prone to having this whitish discharge. So, and this whitish discharge is synonymous with pregnancy. If you ask any woman who has conceived and had baby before, they will tell you that throughout the 9 months of pregnancy, they do have whitish discharge or creamy discharge. So when this creamy discharge or whitish discharge starts, it's due to pregnancy. But some days after that, if the pregnancy is lost, it will subside and stop. That's because the pregnancy has been terminated, so the discharge too will cease. The same thing goes for the other early natural signs that I've mentioned. They feel weak and tired, but when the pregnancy is lost, the weakness and tiredness will fade away. They feel internal heat, external temperature. When the pregnancy is lost, the temperature disappears. They feel the urgency and frequency of urination. When the pregnancy is lost in a week or so, all that stops. So these are the natural signs of pregnancy that we need to increase the awareness in women. And when they come for natural fertility consultation, these are the things we try to find out from them to be able to establish where they stand. What has been happening to their body system? Do they have infertility, or they've been having conceptions which they are not carrying to term due to early miscarriages? Then,
thank you, doctor. Sorry, before our doctor, we are live with Kekere, and he has been talking to us about natural fertility. If you are just joining us, he has been talking to us about natural fertility, and you've been enjoying what we've been saying, and you are like, okay, I want to talk to Dr. Kekere. You can just go on the Teledoc app. You can search for his name, Dr. Fuad Kekere. Book a session with him, or better still, we have a link directly to his account. Just click on our profile. Is the Doctor of the Week. Just click on our profile, the link. You will see the Doctor of the Week session. Click it. You will download the app, and if you're already on the app, it will take you straight to his profile. Just book him and have a session with him. Then you can have further consultation with him over there. So, to continue, Doctor, please continue.
Okay. We also, equip ourselves with more understanding of the natural fertility by trying to understand the miscarriage bleeding and the menstruation. How do we differentiate the menses bleeding from the miscarriage bleeding? A lot of times, or a lot of women believe that the bleeding that they see every month is always menstruation, menstrual bleeding. This is very wrong, because a lot of times women have miscarriage bleedings on a monthly basis without them being aware of it. Some of them even believe that they've never conceived before, whereas the bleeding that they're experiencing every month are miscarriage bleeding, which means they've been conceiving and losing the pregnancies quite early without being aware of it. So how do we differentiate the menses bleeding from the miscarriage bleeding? Number one, the menses bleeding, the menstruation bleeding, usually comes on the day that is expected, if, like I said, the menstrual cycle is 27 days, when we expect to see the menstruation on that 27th day after counting from the beginning of the last menstruation. If on that if the bleeding is observed on the 27th day, it's most likely menstruation or menses bleeding. But if we notice bleeding coming some days before the expected date of menses, like on the 23rd, which is before the 27th day, or some days after the 27th, like on the 32nd day of the cycle, these are most likely miscarriage bleedings. Some women will wrongly presume that they're having an irregular menstruation. You know, all the months and years they've been menstruating before they got married, they never had any of this irregular menstruation. So when they got married, because they are getting pregnant and losing the pregnancies early, they start to have bleeding that are not regular. Because those bleeding are not menstruation, they are early miscarriages due to loss of the early loss of pregnancy. So when we don't see the bleeding on the regular dates, then it's most likely we're having an early miscarriage. Number two.
Okay, continue, sir. Sorry.
Yeah. Number two, the bleeding of menstruation comes with a generalized pain. They feel the pain all over the abdomen, and the pain is mild, mild cramps, you know. But the bleeding of miscarriage comes with a localized pain. The pain is at one spot in the lower abdomen to one side, usually to the left side, and in some people to the right side. And that is at the spot of implantation of the pregnancy. Because the uterus is located in the lower abdomen, and the implantation is inside the uterus, they feel the pain in the lower abdomen at the spot of the implantation of the pregnancy inside the uterus. So it's usually in the lower abdomen. And this pain, unlike the pain of menstruation, which is mild, this pain is usually very severe, intense, and excruciating. And the pain irradiates to the waist at the back. So, and it is sustained at the back. So most women experience it as a lower back pain, which is severe, you know. So, and it radiates sometimes to the thigh and to the leg. And they also feel the radiation to the navel. So when we feel this intense localized pain in our the lower abdomen, which goes to settle in the waist at the back, and is sustained there at the back, and women are complaining of severe back pain. This is due to a miscarriage. The menstrual pain is usually mild and generalized. It's felt all over the abdomen. But the one that they feel at the back and is very severe is due to a miscarriage bleeding. Sometimes they will be feeling this pain starting gradually when there is no bleeding yet. This is a warning signal that they are about to have a miscarriage, because the pain is coming from the spot of implantation. And this is due to the presence of weak implantation. Those who have weak implantation are prone to having these early miscarriages. So because of the weak implantation, if they are stressed a little, there will be pain from the spot of implantation, which is a sign that the pregnancy is about to be lost. The pregnancy is about to break off from the implantation site and lead to a miscarriage. So this is the second effect.
Okay, so before we continue talking about the pregnancy being fertile, so doctor, can you please tell us the relationship between and what causes a woman to be infertile? You made us understand that every woman is fertile or something like that. So what can cause a woman to experience not even being able to conceive?
There are infertility cases that are not explained. They just occur naturally. The woman may be ovulating and menstruating regularly, but for one reason or the other, maybe due to the problem of the endometrium, which is the wall of the uterus, not being able to hold the fertilized egg, if the egg is not implanted into the wall of the uterus, pregnancy will not occur, it will not start. And this may be, seen as a case of infertility, because despite regular intercourse, there is no conception. Because if egg is even fertilized, if the egg cannot hook on the endometrium, on the wall of the uterus, because of the nature or texture of the wall of the uterus, then the woman cannot start conception. The pregnancy cannot start properly because it needs to be implanted into the wall of the uterus. But most infertility cases, has to do with the woman's ability to ovulate. The woman is feminine, is the woman because she releases eggs that can be fertilized. When a woman is not ovulating, then she's naturally infertile. And that problem needs to be addressed by the specialists. Hormone profile will be done. If there's hormone deficiency, there will be a hormone replacement therapy and the rest of it. But a lot of cases, there are ovulations, and there is actually conception, like what I'm talking about, but there are very early loss of pregnancies due to weak implantation. The first one I mentioned was that lack of implantation at all, because the wall will not hold the fertilized egg to start the pregnancy. So the second one is one that can be helped naturally, but we need to first equip ourselves with what is happening. That is, there's implantation, all right, but the implantation is weak. So what do we do in cases of weak implantation? That's what we address in natural fertility. But we need to first explain in details how this occurs, why it occurs, and what can be done about it. So I will request that you allow me to continue where I stopped, where you interrupted. It's because these are things that make us to understand better what is happening.
Yes, sir.
So the first two differences between the menses bleeding and miscarriage bleeding that I mentioned. Number one, the bleeding that comes before the date of expected menses or after the date of expected menses is most likely miscarriage bleeding. The menses bleeding will come on the date of the expected menses of the cycle. Number two, the pain for menses bleeding is usually mild and generalized, but when the pain is localized in the lower abdomen and it's sustained and retained at the lower back, and the waist at the back for a long period of time is severe, the person is having a miscarriage. Number three, the bleeding of menses usually comes like a red flow. For miscarriage bleeding, usually the flow is darker and it's more scanty. And when it is an early miscarriage, they will notice several small dark clots of blood in the flow. So we are noticing these dark clots, and we notice the volume or quantity of the bleeding is much less and is darker. This is likely miscarriage bleeding. The menstrual bleeding that women have experienced for months and years before they got married, usually much, and it is red, frank red. When you're having the darker ones with dark clots of blood inside it, it's usually miscarriage bleeding. Then all of a sudden, they notice the number of days of the bleeding is reduced from like 5 to 7 to like 2-3 days. And they think their body system changed. No. When the bleeding is like 2-3 days and they see spotting and stains on the third day or on the fourth day, this is usually due to miscarriage bleeding. So that takes us to why are some people having conception? Most of them are not aware. Why are they having early miscarriages? When women conceive, when they get pregnant, they either have a strong implantation or a weak implantation. Those who have strong implantation, the pregnancy, the fertilized egg is implanted into the wall of the uterus very strongly. It plugs deep into the wall of the uterus. those people in the early stage of their pregnancy, no matter how much they stress themselves, the pregnancy remains intact. But a lot of other women do have weak implantation, which we don't readily know the reason for this. Some women, they've had strong implantation before they've had babies, and then after subsequent pregnancies, they start to have weak implantation. So those who have weak implantation, the implantation is very weak and fragile and delicate, and is superficial. It doesn't go deep into the wall of the uterus. So such people, any slight shaking to their body or any little activity or stress, the pregnancy comes down and they have an early miscarriage. And that weak implantation, it's at its weakest in the very first few days of pregnancy, when the pregnancy just started. And that is why we have the early miscarriages occurring mostly in the first week of pregnancy, because that's when the implantation is really very weak. Any little shaking, vigorous shaking to the body, the pregnancy comes down. So in these cases, if you have noticed somebody having these early signs of pregnancy from our interview, from our history taking, and we've noticed that the bleeding she's been having are bleeding of miscarriage and not, so we will know this person is having this recurrent early miscarriages due to weak implantation. And the solution to this weak implantation is that we place such women on bed rest. We refer to it as total and complete bed rest. We restrict their movement and prevent them from engaging in any activity, because very little stress will affect the implantation and the pregnancy will come down. So we place them on very strict bed rest rules, and it's better when they are being monitored so that they can comply accordingly. So this is what we usually do in under natural fertility. We try to solve the problems first, if they are solvable, or if we find out that the problem is due to infertility, that is inability to get pregnant, then we refer very quickly to the specialists, where they will be investigated for infertility, and whatever is found to be the cause will be treated accordingly.
Thank you, Dr. Kekere, for that insightful answer.
If you allow me, I can also talk about some other areas of natural fertility.
Before we go to that area, sir, please, because of our time with you, sir, so we don't want to extend and got into your own schedule, sir. So also, moving on, can we talk about, is there anything natural means or what a woman or a man needs to do to to improve their fertility? We talk about miscarriage, what can cause infertility. We talk about fertility itself, but what natural means or maybe lifestyle changes or anything that a woman or man or couple looking for fruit of the womb needs to do so that can boost their fertility. Thank you, sir.
Usually the fertility of women has got to do with their ovulation, their releasing of egg, and most women who menstruate every month means that they ovulate every month. And if they ovulate every month, it means they are fertile. They don't really need much fertility boost, because it is when they ovulate, if the egg is not fertilized, ovulation means the release of the egg from the ovary into the uterus, waiting to be fertilized by the spermatozoids coming from the man. So if the egg is not fertilized during that window period of ovulation period, the egg will waste, and then menstruation will follow. So this tells us that any woman who is menstruating regularly should be assumed to be a fertile woman. You understand? But in some cases, there is no regular ovulation, like a woman who is menstruating in every 3 months, every 4 months, or she doesn't know when the menstruation will come, whether sometimes after 2 months, sometimes after 4 months, is irregular, but it's not coming on a monthly basis. This usually occurs in women with ovarian cyst or those with multiple cysts that we call polycystic ovarian syndrome. So when they have this condition, it affects the function of the ovary to be able to release egg regularly. So, and this makes the egg production and release not to be monthly. So, but whenever the egg is released, such women can still get pregnant. So the chances of fertility are reduced, and that can also be treated so that the ovulation can become more regular. So, but we try to let people understand that the fact that they are not ovulating or menstruating every month does not mean that they are having infertility issues. That is, that it doesn't mean that they've not been getting pregnant or they cannot get pregnant, because whenever they still ovulate, they can get pregnant. So, but if there's what we call anovulation, the woman is not ovulating at all, then that needs to be investigated and treated accordingly by the specialists, gynecologists, and fertility experts. You understand? Because they know how they will investigate it and what to do about it accordingly. So for generally for men and women, things that affect their level of fertility are their diet, their lifestyle, and the kind of drugs they consume. You know, their diet needs to be natural as much as possible. Part of what we teach under natural fertility, they should avoid mostly processed and refined foods, because processed and refined foods contain chemicals in forms of additives, flavorings, colorings, preservatives, and some of these things can lower the immunity. I mean, cause health conditions like high blood pressure, can be cancer-causing agents. Some of these chemicals that are given as additives added to the products as preservatives and additives. So they should limit the consumption of processed and refined foods as much as they should go for natural organic foodstuffs. Buy their natural foodstuff from the market and cook naturally and eat. You know, and they should include fruit and vegetables regularly in their diet to make their diet to be balanced. And they should avoid food that affect fertility, especially in men. There are some foods that have been noted to affect men's fertility. The consumption of simple sugar, you know, in form of white sugar and sugary drinks, should be reduced to the barest minimum, because they destroy the sperm cells, the spermatozoids that are supposed to fertilize egg. They weaken the man's physical strength to be able to perform well during sexual activities, and they can also affect the erection. If there's no erection, there can't be sexual activity, and without that, there cannot be ejaculation that will lead to the release of spermatozoids that will swim into the uterus to go and fertilize the egg. So sugar and sugary drinks are not healthy for the fertility of a man. They also have, adverse effects on the health of the woman too. Someone who consumes a lot of simple sugar and sugary drinks can be having frequent infections, frequent boils, can develop obesity from overweight. It has, ways of, making someone to be predisposed to diabetes, and it can also make someone to be predisposed to cancer, different forms of cancer. So we should cut down on our sugar consumption. Similarly is the consumption of artificial spices, what we call MSG, monosodium glutamate. well, they do affect the production of spermatozoids and the ability to produce healthy spermatozoids, and they may also affect the man's ability to have good erection, can cause erectile dysfunction and all that. So we avoid that, and we advise women to go for natural spices, to avoid all these kind of problems that has got to do with diet. To boost women fertility, we place
Sorry,
them on
before
regular.
you talk about before you talk about boosting woman fertility, so if you are watching us live right now and you have a question for our doctor, please you can drop it inside the comment section. When we are done, the doctor will answer the question. We are live with Dr. Kekere. If you have been enjoying us and you want to speak to him, you want to book a consultation, just click the link on our bio and you'll be directed to his personal profile page on Teledoc app to book him. You can book him and have a session with him. Please continue, sir, on the boosting, sir.
Yeah, for women's natural fertility, they should avoid, just like we place them on regular folic acid, because folic acid helps to strengthen the implantation. So we even place them on this folic acid, a tablet daily, while they are still trying to conceive. So if they are prone to having weak implantation, the folic acid will improve the the implantation strength, so and to be better than just not being on folic acid. So that helps, and it's in cases where the ovulation is rate is very low, they can now place them on hormonal drugs. These are usually what they get from the specialists, hormonal drugs that will boost their fertility rate by improving their ovulation rate and quality.
Thank you so much, sir. And I personally have a question for you. And my own question is um, for a couple that they are trying to conceive naturally. I understand that they need to seek the help of a specialist, a gynecologist. But let me ask you, sir, that what do they have to avoid when they are trying to conceive naturally?
Yeah, that's what I just explained. They should
Like
live.
avoid. Uh, you talk about, I understand that you talk about the food. They should avoid some food. The couple should avoid sugar. They have sugar. What are the maybe some things? Maybe we'll talk about lifestyle changes. I'm talking about any other thing. When you want to conceive uh, naturally or increase their chances, maybe the time they want to meet together or something like that. So that's what I wanted to discuss with us.
One very strong point that easily leads to infertility in women is early promiscuity. If a woman early in life has been engaged in, unrestrained, reckless sexual activities, and she has to, she makes efforts to terminate early pregnancies by abortions, when this is done, the wombs are evacuated. This causes the wall of the wombs to be incompetent in holding the fertilized egg. So the fertilized egg is not able to implant well on the wall because the walls have been traumatized, injured through scraping and the rest. And sometimes the walls, they stick together, causing adhesions. And this can also, if this kind of adhesions occur around the fallopian tubes, because they can cause tubal blockage. So a woman who wants to be free from infertility issues should live a good moral life so that she won't be forced to be committing abortion. Because once they start to have abortions, especially those who have it frequently, the internal wall of the uterus, the endometrium, will start to stick together and cause adhesions and tubal blockages, which may cause, permanent infertility. And for them to be able to conceive, they may need assisted, reproduction like the IUI or IVF. So these are things that women should learn early, in life, because once they start to subject their body systems to these abortions early in life, they damage their uterus, and it becomes very difficult for them to conceive later in life. And they have these infertility problems, which may be difficult to treat.
Thank you so much, Doctor. Really appreciate your valuable time here, walking us through understanding fertility and also letting us know about what we can avoid, what we need to avoid, and what we need to do so that natural conception can occur. So we appreciate your valuable time that you've spent here with us. We are very, very grateful for today, sir. God bless you, sir. And
it's my pleasure. Thank you very much.
Also, we'll also reach out to you after this live video because we still need you to talk to you about some things relating to the app, the booking of the patient and the likes, because people are going to reach out to you after this live video on fertility. That's what we've been saying, that if you have a question relating to fertility or you are trying to conceive and does not been forthcoming, we have an expert in Dr. Kekere right now that you can book right now on Teledoc app. And if I'm talking to you, you can just go on our profile, on Teledoc profile, there you will see the link. It is straight into his profile. You can book him on Teledoc app. So, Dr. Kekere, once again, thank you so much. We are so grateful for having you in our life. And we hope that you will come tomorrow and we say, Dr. Kekere, come and speak to us about this, or come and sensitize our followers on this topic. You will do us the other. Thank you so much, sir. And perhaps putting up and to put everything into a better perspective, can you please give us on a final note? Just give us a summary of brief advice for people, for all our farm followers, and then we'll round it up, sir. Thank you.
Yeah, generally on fertility, there are misconceptions. A lot of the cases that are seen as infertility cases are actually not infertility cases. And this causes a lot of, hopelessness in couples, because they get fed up from trying, seeking solutions, because they believe they have problems that are not solvable. But from our own consultation, we are able to establish two very important facts for them. Number one, they don't have the problem. In most cases, they don't have the problem that they have been made to believe that they have, because they have not been studying their body systems for the early signs of pregnancy and what has been happening to them, why the pregnancies don't continue. So if we can be able to make them to understand this, then they will worry less about being infertile. Because if they can understand that they've been getting, they are fertile because there cannot be conception if the man is not fertile and if the woman is not fertile. They have been conceiving because both of them are fertile. So that rules out infertility. But we are now under stop fertility, where though there's conception, somewhere along the line, something happens to the conception. So this is what we handle. The number two fact that we leave them with is that to get things right, it is a DIY. It is a do-it-yourself thing. They have to be committed. No medical professional is going to observe bed rest for the patient. If the woman is placed on bed rest, she has to comply. You understand? Even the husband cannot observe the bed rest for her. So she needs to understand that she's the one that will help herself in the long run if she's having a case of repeated, recurrent early miscarriages due to weak implantation. So if all these things are understood, number one, the psychological burden is removed, that I don't have a problem of infertility. Number two, I'm ready and committed to help myself. DIY, do it yourself, then by the grace of God, success will be achieved in such cases.
Please, Chichi Thompson, sorry, we did not really get your question well. Is 16M sperm good for IVF? We don't really understand. Oh, doctor, do you understand that question? Is 16M sperm good for IVF?
Yeah, what the person has in mind is that 16 million spermatozoids in 1 millimeter squared area or in a single ejaculation. We say a man has low sperm count, oligospermia, if the spermatozoids count is like from 0 to 20 million spermatozoids in 1 millimeter square area or in one single ejaculation. So 16 million is in that range from 0 to 20 million. Normal count is from 80 to 100 million spermatozoids in one single ejaculation. Between that 20 to 80 is, we are still going to try to build up the level to get up to 80 before we can say, okay, this person has a normal rate. So, but what we have discovered is that those with oligospermia, we should not just discount them and rule them out, because we've seen in our natural fertility practice that a lot of people with the result of low sperm count, their wives do get pregnant severally despite the low sperm count result. Because, millions of spermatozoids, we need just few millions or few thousands to be able to swim into the uterus. And eventually, at the end of the day, only one single spermatozoid will break through the capsule of the egg and fertilize the egg. So sometimes, even though the count is low, we still have more than enough spermatozoids to swim up into the uterus, and the most viral, the strongest out of them will fertilize the egg. So it is not a case that they should rule out the possibility of conception. If they consult with us, we'll be able to establish for them if there have been conception or not. Then if we find out that there are no conceptions, then we will, quickly refer them to the specialist. It is a fertility expert that will now tell them the options, because they will weigh the options and tell them the one that suits their condition best. So if it is IVF, then the fertility experts will definitely take care of that. But for them to know if they have been conceiving or not, regardless of the level of the spermatozoids count, we will be able to explain that to them and also guide them properly. And then refer them when it is necessary.
Thank you so much, sir. I hope doctor answered your question, Chichi Thompson. And also, the customer service will reach out to you to answer the comments you put out there. So, once again, doctor, thank you so much for this time. We hope to see you next time, sir. And we hope that you enjoy the rest of your day, sir. And to our followers, thank you once again for joining us for this wonderful health session with Dr. Kekere. We hope you two have a wonderful day ahead of you. Till next time. Bye-bye. Bye-bye.